active and passive insufficiency. First of all, before going to active and passive insufficiency, we have to see what is two joint muscle, what is multi joint muscle, what is two joint muscle, what is multi joint muscle. Suppose if we take one here, one joint, name chodo, one joint, here one more joint, here one more joint, here one more joint. So here four joints in parallel, okay, four joints in linear, okay, like this, mean four joints are there. If one muscle number, mean muscle name A, if one muscle is connected to this joint, so this is only one joint, okay, single joint muscle. Suppose one muscle is there from here, okay, from here it is connected to two joints, so here one joint, here two joints, so this is nothing but two joint muscle, it is going to cross the two joints. Now we'll see what it is multi-joint muscle. Multi-joint muscle means one muscle will be there. It is going to connect to the more than 1, 2, 3. It is going to connect to the cross over the more than two joints. If a muscle is crossing more than two joints, that is called as multi-joint muscle. So now this active passive insufficiency will happen in the two joint muscles. Okay. First we'll see what is active insufficiency. What is active insufficiency means, suppose here one muscle will be there, that muscle is two joint muscle, it should be two joint muscle. Active insufficiency, what will happen? The muscle will shorten more after a point of time. Muscle will be unable to shorten further. So this is active insufficiency. So active insufficiency means that it will happen to joint muscle will shorten first, after that unable to shorten further. Shorten first means here it is two joint muscle, the where it is connected to two joints, at two joints levels it will contract. Which contraction? Concentric. Because it is shortening, it is concentric contraction muscle will do at the two joints, so that after one point of this concentric contraction, muscle will be unable to do further concentric contraction. That is active insufficiency. Example for this. So if we take forearm flexors, suppose here one patient is there. This patient, he rested his elbow on the table. This is elbow table. So here first if he do wrist joint flexion, see here all the muscle fibers which are present here, because of wrist joint flexion these muscles will go for shortening. After this, if patient tries to make a tight fist, after wrist flexion, if patient tries to make a tight fist, here it will not happen. Here tight fist will not going to happen, because if you are doing tight fist like this, already in this moment flexors will be shortened. Again, if we are doing this tight fist, these muscles are unable to shorten further, so that here tight fist will not happen. So here elbow, forearm flexors are in active insufficiency. Clear? So that's what here what we are discussing. Same, that's what here first diagram we are seeing. Active insufficiency, already wrist joint is in here, flexion, here. This fist will not go for further flexion. So this is active insufficiency. Now we'll see passive insufficiency. So here passive insufficiency, what it means? Here also first one muscle will be two joint muscle. First, in this passive insufficiency, muscle length will lengthen, okay, up to maximal range, lengthening. After a point of time, muscle will be unable to lengthen more. So this is passive insufficiency. Here muscle lengthening will not going to be increased furthermore. That is passive insufficiency. Here example, if we see same what we saw for active insufficiency, here we are seeing same. Here elbow is flexed, wrist joint is flexed, here wrist joint, then fingers will be like this, okay, these are thumb, these are fingers. So here already forearm flexors are in active insufficiency. So see here we'll be having extensor muscles, these are flexors, these are extensors of the forearm, muscles. When we do this movement, automatically fingers will be in extension only. If we did this movement, fingers will be extension only. Fingers will not go for flexion, because the extensor muscles which are present here, which are present here. When we did flexion of the wrist, the length of these muscles is increased. When we are trying to do this flexion, this muscle length is not increasing because the lengthening it is unable to do lengthen more. So if you do like this, flexor muscles will be in active insufficiency, extensor muscles will be in passive insufficiency. Suppose if we do wrist extension, fingers automatically will go for flexion, it won't be in extension. If we do wrist flexion, fingers will go for extension. If we do wrist extension, fingers will go for flexion. So here the point is, when we did like this wrist extension movement, so in that time extensor muscles will be in active insufficiency, flexor muscles will be in passive insufficiency. If you do like this, that will be reverse. That's what here we are seeing. Here suppose flexor tendons are here. Suppose flexor tendons are here, extensor tendons here. In this, these extensor tendons are in passive insufficiency. Here, flexors are in active insufficiency. If we do reverse movement, here flexors will be in passive insufficiency, extensors will be in active insufficiency. So this is about active and passive insufficiency. Two special points we will see. Suppose here active insufficiency and passive insufficiency. Okay, now we'll see only 2 points. Active insufficiency is nothing but the muscle cannot going to do further more shortening, so that here myosin will be there, here actin will be there, here actin will be there. So this is optimal length. This is optimal length of the muscle, optimal length. What will be, how this structure will be in active insufficiency? Myosin will be there. So actin, see, this is one actin, this is one actin, here this is one more actin. So the overlap between myosin, actin, and here also one more actin, it will be maximum, that is active insufficiency. From here, if we want to do contraction, the overlap is completed here, it won't go further shortening, that is active insufficiency. Passive insufficiency, how it will be? Myosin will be there, okay, myosin will be there, but actin will be far from this myosin, there is no cross bridge formation. Actin will be like this, there is no cross bridge formation of the myosin and actin. So that's what passive insufficiency. This we can observe in muscles. Okay, now we'll see 1, 2, 3 examples. Okay, these are some examples for this active and passive insufficiencies.